So by training and by experience, I started out in primary care. And to me, primary care is really about communities and community health. And I looked at, when I came to Buffalo back in 2016, I looked at the opportunity for just building on both a legacy and resources. What I saw was a lot of really, really incredible people who worked at Robert Warner and worked on behalf of children with disabilities, and thinking about how do we take it to the next step. We have a lot of incredible individuals, we have a lot of community, we have a lot of community support, and then how do we just keep pushing it? I think one thing that I want folks to understand is that we are seeing more and more children who have special healthcare needs. In pediatrics, we used to see a lot of infectious disease. We used to see a lot of kids who came in with these kinds of infectious illnesses. And we also had a lot of kids who did not live past infancy because of just previously fatal conditions. And really, in my career, and I've been doing this for 20 years, we've seen a lot of kids who now live. And not only live, they live well. And as our healthcare needs keep changing, there is just increasing demand to really keep our kids at home well, and just put all of our services together and just make sure that our families have what they need to thrive. And it's growing. We've got a lot of really incredible people. The community support here is just amazing. And this is a place to make things happen. First we talk about how COVID doesn't make children physically ill from the actual virus itself for the most part, certainly not on the scale of adults. But what we are seeing is children whose therapies and health services were just completely disrupted. We had a system that was really dependent on in-person interactions, both in the school and at home. And we disrupted all of that. We disrupted it because of the risk to the caregivers, the risk to the teachers, the risk to the community. And some kids are actually thriving pretty well, and other kids really don't have the structure that they were used to. And there's a lot of anxiety. There's a lot of uncertainty out there. We have endeavored to manage this by really just reaching out to folks. We've implemented telemedicine. We've gone down lists of kids and families and reached out to folks and said, we're still here, and it's not just we're still here. We want to move forward together. We'll determine as much as possible what's the safest thing. In some cases, it's telemedicine. In some cases, we will bring you in, but make it as safe as possible. But the disruption is that our services, a lot of them are disrupted, and we had to adapt. It is really important to support the rehab center with your donation, because we're here for the kids who really just historically have fallen through the cracks. We want every child to have the chance that they need to be able to grow and thrive. And we take care of the kids that really need a level of support that carries on, and we carry on a legacy that Dr. Robert Warner started, decades ago. Our children with special needs are very precious to us. They demand a lot of support from us. They demand a lot of attention, and the rewards are incredible.